shall go on to our next debate. This topic is, does vitrectomy itself in intermediate uveitis have a therapeutic role? And the two speakers to talk for and against, one is Dr. Soumyava Basu, who is the head of retina and vitreous and uveitis services from LV Prasad, Hyderabad, and Dr. Sudarshan, who is the associate consultant again in the uveitis department of Shankar Netralaya, Chennai. So, and the discussants here are going to be Dr. Sangwan and Dr. Ratnam. And of course, other two could chip in anytime. So on to you, Dr. Basu.
Thank you, Dr. Chitra. I hope I'm audible to everyone and
Right.
The slide is seen. So here goes the topic. Does vitrectomy in intermediate uveitis have a therapeutic role? I think the first question that we need to ask is, what is the actual question? Does vitrectomy in intermediate uveitis have a therapeutic role? Yes. But if you ask, is vitrectomy the therapy for intermediate uveitis? Definitely no. This clarity has to be there before we start the debate. Now, why do we say that it has a therapeutic role? Now, several studies have shown multiple anti-inflammatory mechanisms of therapeutic vitrectomy for any uveitic entity, including intermediate uveitis. This includes the removal of the pro-inflammatory immune cells as well as the secreted cytokines, removal of the helper T cells. This is very important because these are the cells that recruit other cells into the inflammatory milieu. And then also removing the antigenic load that is driving the inflammation. So all of these together definitely help in reducing the therapeutic burden of corticosteroids and immunosuppressive drugs, non-steroidal immunosuppressive drugs, which are required otherwise for the treatment of intermediate uveitis. Besides this, we know very well that many a times after the inflammation has resolved, it can, the vitreous opacities can still persist, and here an optical vitrectomy is of great use. So this is how intermediate uveitis, therapeutic vitrectomy can help in intermediate uveitis. Now, apart from the anti-inflammatory role, vitrectomy also has a role in managing the complications of uveitis. This could be the ones that are at the vitreoretinal interface, such as the ERM or a cystoid macular edema, macular hole, or those that are caused by traction, such as vitreous hemorrhage, traction detachment, or a rhegmatogenous detachment. Besides this, when we are doing a pars-plana lensectomy for a complicated cataract, especially in pediatric intermediate uveitis, or like I mentioned earlier, in the presence of persistent vitreous opacities, pars-plana vitrectomy has a role in the treatment of intermediate uveitis. Now, we are often concerned about the safety of the surgery in these patients. Now, with the advent of small gauge vitrectomy, and if we use sharp trocars, use relatively low suction, and then understanding the fact that most of these eyes actually have an established posterior vitreous detachment, or they may just have a tug which is only attached to the disc. These are the cases where it's very easy to do vitrectomy without applying too much suction on the areas of vitreoretinal adhesion. Finally, if at the end of the surgery we do at least a partial air exchange and then suture the ports as frequently as possible, the risks of post-operative hypotony also become very less. Now, several complications have been attributed to therapeutic vitrectomy. The ones that are known are cataract and hypotony, but the ones that should be understood is the post-operative retinal detachment, which is probably the biggest concern while doing vitrectomy in an inflamed eye. Now, if we see that for MIBS in general, the rate of post-operative RD is 1.57%, while in uveitis it ranges from 2.38 to 2.8%. And remember, the numbers are much smaller here. So the rate overall doesn't seem to be very different from what it is for MIBS in general. Of course, the other unexpected complications which we should be aware about are raised intraocular pressure and postoperative CME. Now, I'll end my case with this review of literature. This is probably the largest series on the analysis of remission of intermediate uveitis. This is from the site study data from the US, and this clearly shows that prior pars plana vitrectomy was one of the predictive factors for remission of intermediate uveitis. I think this should really seal the case. So to summarize, the anti-inflammatory mechanisms of pars plana vitrectomy, which helps in also reducing the therapeutic burden of corticosteroids and other drugs, its role in managing the complications, the safety of this procedure, and the literature support from different studies that have looked at vitrectomy for intermediate uveitis should establish the case that it does have a role in the management of intermediate uveitis, though it cannot be the only treatment in its management. Thank you very much.
Thank you very much.